like Tony, I'm gonna introduce myself first, okay? Okay, my name's Dr. White. I'm not gonna say I'm the best, right? But pretty good. Like NFL player come here, like Olympic coach, Argentine player come here. I think I say in picture. This is Olympic like medalist. So this year she won like silver medal. Like new surgeon. If you need surgery, I'm gonna refer you to him though. And then like
he does knee surgery.
Yeah, new surgeon.
Oh, new surgery.
Yeah, so like he do some like surgery.
Yeah.
So like and then like chief of the police is my patient too.
I work in construction. That's why these guys. Sports. I figured.
Oh, I see. What happened to you? You say lower back pain?
Yes. So for a few years I had lower back pain.
A few years already?
Yeah.
Wow.
So just back pain, but it was never that bad right here.
Okay.
But then on Thursday it started hurting like right here.
I see.
Thursday it wasn't so bad. I was able to go to work. Friday I was like struggling to tie my shoes.
Oh.
Saturday same thing, but I had to help my wife cut down the tree, so I was like picking stuff up.
Oh
and
my god.
The pain went away. Like I started working like around Saturday morning, like around 10 a.m. in the morning.
Oh.
But pain went away. I went to bed at night with no pain.
Oh.
Then Sunday morning I couldn't get out of bed.
Oh wow.
I was right now it's still kind of pain is going away. My brother-in-law gave me some of her old pain medicines for temporary.
Okay.
I took one of those, made me feel better, but right now it's still pain level is I would say like 4.
4, 5. Okay. Okay. Let me see. Okay. So your low back. Oh, like you want to sit down first?
Yeah.
Okay.
So I got a right shoulder. Let me take this off.
Wow. Okay. Sure.
I
Just be careful.
because the only reason I put this on, the pain in my back, it started making me hurt right here.
Okay.
Like it started going around for some reason.
I see.
But,
Oh, yeah, you can put anywhere, like put on the chair. So for low back, okay, so you say like here, right, or all this.
yes.
Okay, like lean back you hurt more or lean forward?
Lean forward, it hurts more.
Lean forward. Like how about lean forward is okay, right?
Right here, the only times it hurts, at the end of the day when I'm working, I'll bend over. The lower back feels like it's kind of like opening like this.
Okay.
It kind of feels like liquids down here, but
I see. And then, so just holding one side, okay? Any pain here? It's okay.
just in the middle back.
A little bit, okay. How about this side?
In the middle back.
And then when I was like, you say 4, 5, 5, 6, right? 6, 7, okay. Put the lumbar here. Does it go all the way down to the feet? No, just local. Okay.
I have a feeling my body's all messed up. But
Your body was all messed up.
last year,
I
injured my knee.
Oh, how did you injure?
I was working.
Working.
Construction.
Oh wow.
They told me I don't need surgery. And I went to physical therapy, and they told me just give it time and it'll heal by itself. But it's not the same.
It's not.
But I feel like because I can't put as much weight on this leg, there's a buckle.
Okay.
So a lot of weight's on this leg.
Okay.
So I feel like it may be causing an imbalance.
Okay.
In my back. I don't know if that may be.
I see. I can double check. Oh, make sure your driver's license. You prepare your driver's license. And then you say you went to physical therapy. Like, what did they do? Just exercise?
Just exercise. They were just making me do this. I can barely because.
Oh wow.
My kneecaps like obviously messed up. But they were just making me do exercises.
Okay. So like, who pay for it? You pay for it? Your insurance pay for
it? I don't have insurance.
You don't have insurance? Oh, I see. So like, how much for physical therapy?
That was, I think like in total, I did like 3 visits. It was like 400 something.
Oh, 3 visits for 400? Oh, okay.
Like 30-minute sessions.
30-minute sessions. So like, is it one-on-one session? They teach you how to do the exercise and then.
I told myself I didn't want to keep going because it was getting expensive.
I see.
And it was. I feel like it wasn't really.
It's not heavy. Like, I can tell you. I can tell you, all the patients come here. They went to 4 or 5 different MD medical doctor. At the same time, they went to acupuncture. They went to physical therapy. It's not going to help. Yeah. Like even the registered nurse, they all went to physical therapy. Yeah. So when they come to my clinic now. So last one, like just like sign here too. Like sign one. Until you touch the ball. Okay, good. Tony, turn this side. Okay. Okay. Make sure hang on the side. Okay, step back. Okay, perfect. Okay, so Tony, this one is AP open mouth, so you need to open your mouth. Okay, that's good. Okay, so good. And then facing the wall this time. Okay, Tony, this time hand and elbow. Where it is? Oh, good. Okay, okay. Step to the left until you touch the ball. Okay, okay, good. Okay. Step forward a little bit. Okay. Done. Very good. Okay, step to the left. Good. Okay. Oh no, it's okay. It's okay. Good. Stay here. Okay, good. Okay, you can lower down your hand now. So, okay, turn this way. Okay, okay, good. Okay, so here. Okay, body move this way a little bit. Okay, good. Okay, so. Okay. Good. Okay, so take it down. Okay. Yeah. Okay, so this is your initial X-ray, right? Next time you come here, I'm gonna do all this measurement. I'm gonna explain to you for more detail with all this software measure, right? But at first, you need to know what's normal first. Green color is normal, red color is not normal. This is spinal degeneration, right? Okay, normal you can see the curve. The neck you can see the curve. So this phase one degeneration. The neck will be so straight, right? Your neck is so straight already. So number one, I did get a curve back. Okay, you can see this, right?
It used to be like this.
Yeah, like this should be like this, like. Okay, like the neck should be like this, curve. This is 1960, 65 years old, right? The curve is like this. This is 1967. This is 60 years old patient, right? These are all my patients. So of course I put all the patient information, right? So you can see the curve. Your number one, your neck is so straight. Okay, number two, okay. So later on, if you don't fix it, start with this bone spur. Start with 2 bone. Like if you don't fix it, 2 bone, 3 bone, 4 bone. Like 2 free bone, right? Like 2 free bone. Like how here? It's okay. 6, 7, okay. Here, 4, 5 here. 4, 5.
Okay.
How about here? And
That's like a 6.
6, okay. If I go down a bit, it's like anything. How about here? It's okay? Okay, I'm check this side. 4, 5 here, 4, 5.
That's like about a 3. Right there. Yeah.
Okay, so up here is more.
That's like about a 3.
Okay, so how this one? Uh, 4, 5 here, 5, 6. Okay. So because you need to let me know more pain is more damage, so I need to find out which area is damaged. The machine can fix it. Yeah. Okay, how about here? It's okay.
That's good right there. I think it's a little bit more down.
More down?
Yeah, it's towards the spine a little bit.
To the spine? Okay.
Alright, I'm not feeling nothing more right there.
It's okay.
Yeah.
Okay.
Yeah.
How about here? 4. Okay, how about here? 4, 5. 2. So here is a little bit more. Two right there. Okay. Oh, so tell me how do you feel now? A little bit better?
Yeah, it feels a little bit better. I felt the muscles tensing up, and I was trying to massage those at home, so it feels a lot more better right now.
Better? Okay. But feel much better, right? Before it's like
before I came in here, it was worse.
It's worse?
Yeah.
Like 5, 6, before you say like 5 to 6, when how was the pain level?
Right now the pain's like at a 3.
3? Oh,
2.
Okay, good.
So,
okay, take deep breath in, inhale, exhale. Okay, one more time, inhale, exhale. Okay, one more time, inhale, exhale. Okay, one more time, inhale, exhale. Okay, good. Okay, turn sideways, and face me sideways. Okay, get some chest first. Good. Yeah, low back tight. Yeah, the other side. Okay, it moves a little bit this side. On your back facing up. Okay, scoot up side up a little bit up. Okay, good, stay here. So you saw X-ray, your neck is so straight. I try to get a curve back, okay? So I'm adjust your neck, stay here. Okay. Oh, good, nice. Okay, slide down a little bit, slide down. Okay, good. Okay, just stay here. Okay, I just do some stretching in your neck and shoulder, right? Okay, lift up your head a little bit. Oh, good, relax. Okay, relax. Okay, good, relax. Good, okay, so stay here. So, like, you feel anything move? Like, I feel it, right? Neck, upper back. You feel okay? So you mentioned about mid back pain, low back pain. Okay, so when you get up in the morning, you don't want to keep doing the sit up position, no sit up position, right? Okay, turn your body sideways is easier. Just sideways, and then using elbow hand push yourself up is easier. Okay, good. And then okay, stay here on the low down table. This is good. Just stay here. Okay. Okay. So you saw X-ray, right? But next time you come here, I'm do all this measurement. I'm explaining even more detail. As we age, as we get older, the disc always decrease, right? Yeah, when the disc is compared to pinch nerve, which nerve, okay? So all this yellow color is the nerve from neck to shoulder, even from low back too, okay? So what I do right now, okay? My solution, I try to decompress your spine, make more space for this nerve. So sit all the way back, okay, good, okay? Your hand do this, okay? Because I try to decompress your spine, right? I try to carry on my back, okay? Let's see if I can do this one. Okay, yeah, relax upper back, give me some space, okay, relax, lean back, okay, relax, okay, lean back, okay, one more time, okay. Yeah, mid back still very tight, tight, so because I try to at least like decompress your spine, but like, tell me how do you feel now? Better, right? Better when you come in, right?
It feels a lot better. The muscles feel a lot better. I still feel a little pain.
Yeah,
inside
this
the
is the
spine.
first time you do it. Yeah.
Yeah, but it does feel better than when I woke up this
Okay.
morning. So,
Okay, good.